What does lymphoma remission mean? Have you ever wondered what it means when someone says they are in remission from lymphoma? Lymphoma is a type of cancer that affects the lymphatic system, which is part of our immune system. When we talk about remission, we are referring to how the cancer responds to treatment. In remission, the lymphoma has either significantly shrunk or is no longer detectable by current medical tests and scans. There are two main types of remission you should know about. The first is complete remission. This means that there is no detectable evidence of lymphoma in the body based on tests and scans, and any symptoms have disappeared. It is important to note that some doctors prefer not to use the term cure because there may still be microscopic amounts of lymphoma cells that are too small to detect. Complete remission is often the primary goal of treatment, especially for aggressive forms of lymphoma like high-grade non-Hodgkin lymphoma and Hodgkin lymphoma. The second type is partial remission. This indicates that the lymphoma has decreased in size or extent, often by at least half. However, some cancer cells or symptoms may still be present. Partial remission is more common in slow-growing or low-grade lymphomas, where complete eradication can be challenging. Still, treatment can effectively control the disease. It is crucial to understand that remission does not mean the lymphoma is cured. The cancer can relapse, which means it can return after a period of remission. The likelihood of relapse varies depending on the type of lymphoma, the treatment received, and individual factors. For instance, in follicular lymphoma, a common low-grade non-Hodgkin lymphoma, remission can last for several years, but it is typical for patients to experience multiple cycles of remission and relapse. During remission, patients usually have regular follow-up visits and tests to monitor for any signs of lymphoma returning. Over time, follow-up care may transition from specialist-led to general practitioner care, depending on how long the remission lasts and the initial type of lymphoma diagnosed. In some cases, lymphoma may become a chronic condition that is managed over time with ongoing treatment to keep it under control, similar to how other chronic diseases are treated. In summary, lymphoma remission means that the cancer is under control to the extent that it is not currently active or detectable. This allows patients to pause or stop treatment temporarily, but ongoing monitoring is essential to catch any recurrence early. Always remember to consult healthcare professionals for personalized advice and guidance regarding your health.